Hi, I'm Dr. Veera, and today we're going to talk about Osgood Schlatters. What happens is that if you ever get knee pain right here below that knee and you're growing, it's kind of a growing pain, the tibial tuberosity should attach to that bone. But if you're growing really fast, the bone is growing so fast the muscle can't keep up with it. This is very, very common in athletes, whether they're gymnasts or they're runners. So if that's you and you get that knee pain, there's a couple of basic things you need to do. The first one is you need to stretch your legs 2 to 3 to 4 times a day for a minimum of 2 minutes on each leg. And what you need to do your hamstrings, you need to do where your shins are. Another thing you'll notice is something called shin splints. Those are similar muscles to this. So if you want to stretch the outside of your leg, you can literally curl your foot under and you'll feel a stretch here. If you need to stretch the other side of your leg, you can pull your toe in and you'll feel a stretch here. Those are the first things you do. It's going to be really important that you stretch out your calf muscles, your hamstrings, and your quads too. But when I say to stretch 3 to 4 times a day, minimum 2 to 3 minutes each time. And you want to do it after practice. Any kind of static stretching you do after practice. Before practice, you need to do dynamic warming up. So if I have a tibial tuberosity pain, the first thing that I'm going to do is just a little bit of light jumping up and down. And the other thing I'm going to do, I'm going to kinesiotape that. All you have to do is look up the video on how to kinesiotape that. And a real quick overview of that, you take pieces of tape like a feather and you angle them in a V shape right to this tibial tuberosity. Then you take a piece of tape and you run it from here to here. And that will stop the muscles that are rooting into that bone from pulling the bone off. So 1, you kinesiotape it. 2, you stretch. 3, you soak in Epsom salt for 20 minutes. Warm Epsom salt water will actually have some nutrients in it, so it'll get to the bone. That's going to be important. Another thing, do not take an NSAID because NSAIDs stop bone from knitting back together. The last thing you want to do, find a sports chiropractor because they can work on all those muscles for you. A particularly good technique is called active release technique because they'll stretch out posterior tibialis and anterior tibialis, soleus, and gastrocnemius. Those are the 4 culprits that you need to get to loosen this up. Good luck with your shin splints.